This is Dr. Sheenam Bansal. So today we will do the acetabular fractures. See, in the acetabular fractures, firstly, as in the other fractures, we did classification and treatment. It is a two important things for the examination purpose. For the classification, here is Jude and Letourneur classification. Jude and Letourneur classification. Firstly, it has divided the fractures into two types, elementary and associated fractures. In the elementary types, posterior wall fracture, posterior column, anterior column, and transverse fractures. Associated type, both column fractures, in which you see the spur sign, posterior wall plus posterior column fracture, transverse plus posterior wall fractures, then T type, then anterior column or wall plus posterior hemi transverse. Then you have for the radiographs, you have Jude view, AP and lateral. Now, Jude views are of two types, obturator oblique and iliac oblique. What will you do? You will raise the normal side by 40 degree. Okay, so it will give you the iliac view of deceased side and obturator view of normal side. If you want to get the obturator view of the deceased side, then you will raise that part. Okay, in the iliac view you will see posterior column and anterior wall. In the obturator view you will see anterior column and posterior wall. Now in the X-ray you can see spur sign, you can see gull sign, you can see Meta's angle. Meta's angle is from the center of femoral head to the fracture line. So this is the Meta's angle. If Meta's angle is more than 45 degree, then it is good that you can do the conservative treatment. Now in the X-ray, if you are seeing gull sign, then it means posterior wall fracture is there. If posterior wall fracture is less than 20% posterior wall is involved, then you can do conservative treatment, otherwise not. Spur sign is seen in the both column fracture. Now, for the treatment purposes, conservative treatment, as I have already told you, if there is minimum displacement, then that is less than 2 millimeter, then you can do conservative. If less than 20% posterior wall is involved, then you can do conservative. If Meta's angle more than 45 degree, then you can do conservative. Now, in the operative, for the operative treatment, you have many approaches, like you have anterior approach is used for the anterior column fractures, posterior approach is used for the posterior column fractures. For the both column fractures you will use the extended iliofemoral approach. Okay, for the now for the both column fracture you will use the extended iliofemoral approach. For the quadrilateral plate fractures you will use a modified Stoppa approach. For the modified Stoppa approach, you will give incision above the pubic symphysis. Okay. Then it is a horizontal incision. Then you have to take care in the modified Stoppa approach not to damage the corona mortis artery. Corona mortis artery is the junction of the obturator artery and external iliac artery. Then there is iliofemoral approach, then there is ilioinguinal approach. In the ilioinguinal approach, you can damage the femoral artery and inguinal ligament, so there is chances of inguinal hernia. In the iliofemoral approach, you can do the ASIS osteotomy, so there is not damage of the inguinal ligament, and that's how you can prevent the inguinal hernia. In the ilioinguinal approach, you have three windows. Okay, then there is the firstly you should know that in the normal aceta pelvis X-ray you can see the two lines. Okay, this is the upper line is the iliopectineal line, lower is the ilioischial line. Iliopectineal line tells you about the anterior column fracture and ilioischial line tell you about the posterior column fractures. Okay, then you have the for the that was all about the acetabular fractures.